So essentially, the foot posture index is a valid and reliable method or tool used to quantify standing foot posture. Welcome to Foot Pain Explained. Our mission is to share accurate, evidence-based information so you can understand your body better. Now, please remember that whilst we are registered health practitioners, we are not your health practitioners. This means that if you do have any questions, concerns, pains or problems, that we do advise you to consult with a registered health practitioner who can assess and address your needs individually. Now that we've covered that, let's get into it. We need to very much keep in mind that static measures often don't translate to or explain or correlate all the time with dynamic movements. So the foot posture index, like any static measure, should not be used in lieu of or to replace a gait assessment. However, it does give us some quite useful information that we can gather really quickly. Now, the foot posture index assesses, or there's 6 criteria that formulate the foot posture index. So we assess 6 different areas of the foot. So the first is talar head palpation. Then the second is the supra and infralateral malleoli curvature that's viewed from behind. Thirdly, we look at the calcaneal frontal plane position. Now, to assess the frontal plane, this is done perpendicular. So we view this from behind as well. Next, we assess the prominence in the region of the talonavicular joint area. And to view this, we typically do it medially or from the inside angle of the foot. Then we have a look at the congruence of the medial longitudinal arch, which we also do from this position. So looking at the foot medially or from the side or the inside. And then lastly, we assess the abduction or abduction and adduction or adduction relative, or the forefoot relative to the rear foot. So how much the forefoot is abducted or adducted relative to the rear foot. Now, the grading system that is given for the foot posture index, we have +2, +1, 0, -1, -2. Now, the greater the plus or the positive, the greater degree of pronation is considered, or the foot is considered to have. Whereas closer to 0, we're more neutral, and then the more negative, so -1, -2, that is what would be considered a more supinated foot type. Now, unlike other static measures, the foot posture index can actually give us some information regarding whether or the degree or level that someone may have a pronated or supinated foot posture. Now, this is because pronation and supination are what we call triplanar movements, so they occur on all 3 planes. Now, pronation is made up of dorsiflexion, eversion, and abduction, whereas supination is made up of plantarflexion, inversion, and adduction, adduction. And because of the 6 criteria that formulate the foot posture index, this is why it can give us a measure of the degree of pronation or supination, because the areas that we're looking at reflect different dominance of the region of the foot relative to those 3 planes of movement.